My son Josiah, who is 10, we took him to his yearly appointment, just his yearly checkup. And I guess at that age, they'd start checking for scoliosis. So she did, bent him over and just, felt of his spine. And she noticed she said, I'm pretty sure there's a small curvature here. And I immediately, like, red flags went up because I was diagnosed with scoliosis when I was 16. So living with that for as long as I have, I immediately, almost went into panic mode as a parent. When you think there's something wrong with your child, you have a tendency to, you know, to panic a little bit. She said, it's barely a curve. We'll just keep an eye on it. When I took Josiah to get adjusted for his quarterly adjustment, I mentioned to our chiropractor that his primary care physician had found a curve, and I was surprised. He didn't seem super concerned, and so I thought, okay, well, maybe I just need to chill out and relax. Maybe I'm just overreacting. It's probably a really tiny curve and it's just starting. So I didn't push any further, and I thought, okay, well, we'll see what a year does, and we'll go back to our PCP, and she'll check him again, and then if she thinks that he needs to seek further treatment, then we will.
The education or knowledge regarding scoliosis and the risks involved with scoliosis progression isn't something that's covered very well in most chiropractic curriculums or even general physician curriculums. So even general physicians or general chiropractors don't really always understand the seriousness or the risk factors associated with progression. Josiah's case is a very high risk case. You have a child that's 10 years old with a 30-degree curve. Mom already has a severe scoliosis. He is about to go into puberty and go through a very high risk stage of progression. Once you start breaking 25 degrees and you haven't hit puberty yet, you have over a 60% chance of having a surgical size curve by the time you're in the middle of your growth cycle. So he's a very high risk case. Not showing concern is just not knowing what you're really dealing with. And that's the reason why doctors that specialize specifically in scoliosis, like I do with my scoliosis-specific chiropractic care, we know exactly those risk factors, and we know with somebody like Josiah, we're not going to take that lightly. In fact, it's actually more serious of a problem to deal with, or more urgent to deal with than actually his mom.
So I had found Dr. Tony, and I was pursuing Dr. Tony for care for myself. And in my phone consult with Dr. Tony, he wanted to know about my life. He wanted to know how many kids I had, how old they were, and he even asked if we knew of any of my kids showing symptoms or signs of scoliosis. So I told him, I said, well, as a matter of fact, my oldest son is starting to curve. And so Dr. Tony, like, his tone changed immediately, and he said, okay, we need to get some scans on him. We need to go ahead and get x-rays, and we need to see what he's doing. And I immediately took his advice, and I called our chiropractor, and I got him an appointment, got Josiah an appointment to get scans done. So we got his scans, and I just cried. I was not expecting to see what I saw, and it was a version of my curve, just a little bit less. I scheduled the consult with Dr. Tony to discuss Josiah's scoliosis. He recommended 1 week of intensive therapy for Josiah, so that's what we decided to do.
Intensive care is very special, and it's when a patient comes down for care and they spend anywhere from 6 to 8 hours in the office for roughly 5 to 10 days, depending on the size of the curvature. During these days, we're actually going through a sequence of rehabilitation: therapy, traction, vibration, chiropractic adjustments, exercises, neuromuscular education, balance therapy, all these different therapies and rehabs that are customized for that patient to go through to actually improve their scoliosis.
It was kind of hard at first, but then I got used to it, then it got easier.
When Josiah started care here for intensive therapy, he was at a 29-degree curve, his worst curve. Now, at 3.5 days of therapy, they took a follow-up x-ray to see what progress he had made. And he had straightened 10 degrees. He was measured at a 19. So this is a really happy mom right here. Results for both of us were really just amazing.
I'm thinking that I might possibly get it down below 0. I never thought that was possible.
It's just monumental, really. I mean, it's gonna change his life. And Dr. Tony helped me so much. He helped me understand how important it is. He gave me that information so that I could make a better decision for Josiah. When Dr. Tony showed Josiah his before and after x-rays, he just lit up. And I really think the way that Dr. Tony spoke to him and explained things to him, that he developed a better understanding of why we're doing this and what impact it's gonna have on his future.